Hello, everyone. I am Jennifer Bonner, a nurse practitioner here at Washington Regional Medical Center, and we are presenting a webinar in honor of World Stroke Day, which is tomorrow. So we aim to spread awareness of stroke, and our topic today is Be Fast, Recognizing the Signs and Symptoms of Stroke. So we're going to talk for a few minutes about stroke and the signs and symptoms and risk factors. If anyone out there has questions, please feel free to use the chat function to type in questions, and at the end we will address those. Please be aware, though, that the chat function does publish your name. So if you'd like to ask something anonymously, you can email us, and we're monitoring our email at strokeprogram@wregional.com. That's strokeprogram@wregional.com. And we'll discuss some of those questions at the end. So let's get right into it. We're going to talk first about what is stroke. Briefly, stroke is a damage caused to the brain when blood flow is disrupted to the brain for any reason. That can be because of a clot in one of the large arteries of the brain. That can be because of damage to the small vessels of the brain, or in a less amount, but some cases there can be bleeding in the brain as well. What's important to know is that stroke is largely preventable. We can treat it, but it is an emergency by that time, and the best thing to do is to prevent stroke. A little bit about the impact on society. Stroke kills 140,000 people annually, approximately, in America. Every 40 seconds, someone has a stroke in the United States, and every 4 minutes, someone dies of stroke. So while stroke mortality is around 140,000 people in America, every year, almost 800,000 people have a stroke. Many of those don't die, but are disabled. Stroke is also, in America, the 5th leading cause of death for all Americans. So it does have a big burden on our society. If we can decrease that burden, then we can change the impact that stroke has. We can literally save lives. So that's what we're trying to do here today, is increase awareness and hopefully decrease the impact of stroke on our society in America. There are certain risk factors for stroke, some of which cannot be changed. So for instance, location, where you live in America gives you a higher risk for stroke. And as you can see, this is a map taken from the CDC that delineates stroke death rates in America. We live here in the stroke belt, the American Southeast, and the risk of stroke and death from stroke is higher where we live. Additionally, age increases your risk factor for stroke. We can't change that. As we get older, our risk for stroke is increased. Family history, if you have a strong family history, your parents, grandparents, aunts, uncles, siblings have stroke or risk factors for stroke, then that increases your risk as well. And then, of course, race. Certain races are more likely to have certain types of stroke. However, some of the biggest stroke risk factors are modifiable. If you have hypertension, that is a high risk factor for stroke. Additionally, high cholesterol, diabetes, smoking or tobacco use, and coronary artery disease. So you'll notice that these are the same risk factors for heart disease or heart attack. That's because stroke is a disease of the arteries, just like heart disease is. So if we can decrease our risk of stroke by modifying, controlling these factors, making some lifestyle changes, then we can also decrease our risk of heart attack. So let's talk about these risk factors and how to modify them specifically. So blood pressure. If you have been diagnosed with hypertension, or if not, if you have high blood pressure, please see your doctor. If you have high blood pressure, know your blood pressure and keep it under control. That means it may be a good idea to have a way to check your blood pressure in your home and check it daily. Perhaps keep a log of what times of day your blood pressure is higher or lower. This is a log you can then show your physician. If you are prescribed medications for blood pressure, take those as prescribed. Don't skip doses. If you smoke, stop immediately. Your risk of stroke decreases with the last cigarette that you smoke or the last tobacco that you use. So that's important. Stop immediately. Also discuss that with your physician. There are options medically to help you quit smoking. Exercise. This helps keep our blood pressure and blood sugar under control and keep us at a healthy weight. Also, exercise increases blood flow to the brain, and so it improves brain health. Just move more and sit less. In terms of diet, a lower dietary fat intake and an increase in whole grains, fruits, and vegetables is very important. We'll talk a little bit more about diet specifically on the next slide. And then if you have diabetes, similar to blood pressure, know your blood sugar. Check it at home. Use a log to keep up with highs and lows, and take steps to keep it under control. This includes your exercise and your diet that we've talked about, and taking any medications that your physician prescribes for you. So a heart-healthy diet and stroke, this is one of the most important ways that you can decrease your risk of stroke, and you can start this today. So the focus should be on fiber-forward diet, and that means fresh fruits and vegetables and whole grains. These should make up the bulk of your diet with multiple servings of those per day. Add to that nuts, seeds, spices, and herbs so that your food is palatable. And then add fish and seafood 4 to 5 times per week. Fish and seafood have healthy oils that improve brain health. Dairy, low-fat dairy, and poultry can also be added to the diet a few times per week. Other meats and desserts should be eaten sparingly. Another important thing for brain health is to eat socially, take meals with others, and make eating a happy time for you. That increases brain health as well and gives you a better relationship with your food. All of these things will decrease your stroke risk by quite a bit. The other important thing besides risk factors for stroke is to know the signs of stroke. We use a Be Fast mnemonic to help us remember and teach people signs of stroke out in the community. It's important that you and everyone in your family know the signs and symptoms of stroke because time is very important in stroke treatment. So we use the mnemonic Be Fast where the B stands for balance. So does the person or you have sudden loss of balance? This can be dizziness, difficulty walking, or inability to move correctly. E stands for eyes. Does the person or you have sudden loss of vision in one or both eyes, or sudden double vision? This can be a sign of stroke. The F in Be Fast stands for face. So look at the person in the face, or if it is you, look in the mirror. You can't always feel if you have an uneven or drooping face, so you need to look in the mirror and try to smile, or ask the person you're with to smile. Is their face uneven or asymmetric, or is one side of their face drooping? If so, that could be a sign of stroke. The A stands for arm. Is one arm hanging down? Or if you ask them to lift their arms in front of them as though they're holding a platter and one arm drifts to the side or doesn't move at all, that is a sign of stroke. S is for speech. So have the person repeat a simple phrase such as, "The sky is blue." If the person's speech is slurred, or if your speech is slurred, or if the person has trouble speaking, saying the wrong words, or not able to speak at all, that can be a sign of a stroke. And then the T is for time. It is time to call 911. Please don't put the person or drive yourself in your car and drive to the emergency room. It's time to call 911, even if you think you can get there faster. We have a robust pre-hospital system here in our area, and they will alert the hospital that the patient has signs and symptoms of stroke, and then the stroke team can be here waiting on you. Our data shows that persons who arrive to the emergency room via ambulance have more timely treatment than those who drive themselves to the emergency room. So please call 911. So important things to remember. Stroke is an emergency. Many times, because the symptoms are not painful or distressing, a patient may feel like, "I can't move my arm very well. I'm going to go take a nap, and hopefully it's better when I wake up." This is not the time to do that. The treatment is time sensitive, and many patients cannot be treated because they don't get to the emergency room in time. So please call an ambulance immediately. As I mentioned before, call 911. Do not drive your loved ones to the emergency department. The paramedics will get important information that the hospital needs to be able to treat you, including your blood pressure, your blood sugar, your list of medications, and the time that the symptoms started. They will call ahead to us. We will be waiting for you in the emergency department and immediately start the evaluation that lets us know if you can be treated for stroke or not. The other important thing is to teach everyone in the family the signs of stroke. Have something up on your fridge, a fridge magnet or something that shows the signs of stroke. Review with your children the signs of stroke. We all hear of the stories of children who heroically call 911 and save someone and help with treatment. Have a plan for stroke symptoms that includes the kids. Also, be aware that stroke can happen at any age. Many times we see younger people not get treated because the assumption is that only older persons have stroke. That is not true. Younger persons can have stroke as well, even though it's more frequent as people get older. Know your risk factors. Please talk to your doctor openly about your risks of stroke. Don't assume that because he or she doesn't mention it to you that you have no risk factors. You need to speak with them and ask them specifically, what are my risks for stroke? And please remember, those include hypertension, high cholesterol, diabetes, smoking, and any history of heart disease as well. So have open discussions with your doctor about your risk and how to control your risk. If you take medications for any of the risk factors, take them as prescribed. Do not skip doses. Do not change the times of doses. Do not feel that just because you don't feel different when you take your aspirin or your Lipitor, that it isn't working or doing anything for you. It works behind the scenes. So please keep taking your medicines as prescribed. If you do have side effects, speak to your doctor before you stop your medicines. So those are some important things to remember about stroke and an overview of the stroke symptoms. Here are some other resources that I'd like to point out to people too. The American Heart Association at www.stroke.org has a lot of information about risk and lifestyle choices. Washington Regional, here at our hospital, we have information on our main page as well. The Arkansas Department of Health has information, the CDC, and on your screen, I hope you can see that Washington Regional also has a stroke patient question line. This is a voicemail where you can leave a message and we will contact you and discuss any questions that you have with you. So now I'm going to open it up to the chat if there are any questions. One question that we get fairly regularly that I'd like to point out is, what about headache? Is headache a sign of a stroke? The answer to that is a great question, is that some strokes do cause headache, usually along with other symptoms. However, there is one specific type of headache that you should be aware of, and that is a sudden, very severe headache. It's typically called a thunderclap headache, and patients will frequently report that they're having the worst headache of their life. If you are with someone or you yourself has a sudden onset of a thunderclap, worst headache of your life, that could be a certain type of stroke that causes bleeding in the brain and is a cardinal symptom for that type of stroke. So please call 911 at that point immediately as well. We need to make sure that that's not bleeding in your brain, which is a medical emergency like all strokes. The other question that we frequently get asked when we discuss diet and exercise and lifestyle modifications is how to get started. I recommend that you choose sources of information, because the internet and social media has an overwhelming amount of information on weight loss, nutrition, and diets, and workout regimens, ways to lose weight. And some of these are healthy and some of them are not. I think it's important not to get overwhelmed, not to add any fad diets, and so know the source of your information. If you go to the American Heart Association, there's a lot of information there. Also, the CDC gives a lot of information on maintaining a healthy weight, heart healthy nutrition, brain healthy nutrition, and physical activity. But the most important thing is just to get started. So take your dog on a walk around the neighborhood, or just sit less. If it's a time you normally would sit and watch television for a long time, get up and go for a walk. Simply move more. That will be better than what you're doing now. Again, if you're smoking, stop immediately and start making easy swaps in your diet for more fiber-forward foods, such as healthy and fresh fruits and vegetables and whole grains. Just increase those in your diet for now and decrease other things as you go forward. So the important thing is to just get started and not be overwhelmed. And then I do want to emphasize the email at stroke program at wregional.com. You can always email us, and we will answer those emails and any questions that anyone has. We have a clinic that we can get people set up with for stroke care. And of course, we are the region's only comprehensive stroke center here at Washington Regional. There is a stroke team on 24/7 in our hospital. And that means that we're equipped to handle any kind of stroke. So we can evaluate, treat, and help prevent all kinds of stroke, including bleeding, or surgical needs, or anything like that. So if you have any questions, please email strokeprogram@wregional.com or call the stroke patient question line that you see on the screen. And that's it. Thank you very much.